Well, my name is Grace Brinkerhoff, and my title is Patient Safety Assistant. I've been working in Milford Regional Emergency Department since September 2013.
My name is Michael Colella. I'm a Patient Safety Assistant in the emergency room here at Milford, and I've been here for 2 years.
As a patient safety assistant, we're some of the first people that the patients see when they come onto the floor. We kind of get them acclimated to the area and get them changed up if they need to. We have scrubs that people will change into to ensure safety.
During the course of our shift, we always make sure that the environment that we're working in is safe, and we identify what's at risk, what may not be at risk, and where we can shift patients if we need.
Make sure that if they need somebody to talk to, we're there for them, and just we do a lot of verbal de-escalation.
While also monitoring patients and making sure that they're staying safe, they're doing things throughout the day that they need, such as eating, going to the shower, staying busy with activities. We're just there for a lending ear sometimes, and just to listen up and help them through whatever they're going through in life. We range in behavioral health patients from people that may come in for depression, suicidal ideation. They may be in a state of psychosis or mania. Sometimes they are intoxicated by alcohol or another illegal substance. But we do have a large spectrum of patients, including elder care. Sometimes we'll have patients with Alzheimer's or dementia too.
In terms of orientation and training, we go through a one-day orientation with the hospital, all of the new hires in the hospital together. And then for patient safety assistants, they will shadow the rest of us who have been on the floor for a longer period of time, and that can last between 2 days and like a week, depending on how long it takes them to get the hang of it. And we also, along with security guards, will do MOAB training, which is kind of the management of aggressive people. So if they need to be, restrained and kind of held back from the rest of the people to keep them safe, then we're able to do that.
We had a 3-day workshop with a psychiatrist who taught us about coping skills and triggers and how to assess suicidality in patients to know when to expect things to go for the worse. So that was a good experience and learning opportunity here. I can't say enough of how well everyone works together from different departments, and seeing how, when the need's there, everyone rises to it.
I absolutely feel supported. I feel like everyone, has been doing a really good job, especially lately, of communication. And if you have a problem, people are always, there. So I definitely feel like it's a good, positive environment to be in.
Yeah, the support goes from housekeeping to doctors, and in between you have the paramedics and the nurses who are exceptional people and always willing to help, and they can even tell when something's wrong just by looking at you, and that reassurance is comforting, especially when you're working in such a hectic place at times. When I'm here, I do feel supported by my supervisor and team. I know I can look to them to help me with the question I have, or just to lend a helping hand. It also goes beyond that. I also have a charge nurse that's there always, willing to help and see what our department needs to help their department and keep the whole unit safe. So there's always backup, and that's the best part of knowing when you punch in that you're going to have that assistance. Part of the job, we use a program that called Pulse Check, and it's a tracking board, so you can see your patient and essentially things about them, how old they are, male, female, so you can identify them easier, as well as their birthday. Then you can see what everyone has logged in for that patient, nurses and doctors. So you're able to see what the note is that the social worker put in as far as why that person's here, and you can understand. So when you sit down to watch the patient throughout the shift, you have an opportunity to read a summarized report of what brought them into the ER and how you can shift your attention and focus to seeing what their needs might be. And also the culture. Working with the staff in the emergency room is something that's eye-opening, to see the cultural and team dynamics that are at force when you see things like that in an emergency room setting. It's incredible to see how everyone helps each other and someone always has your back. to me, being a part of a team like that is really important. I do feel appreciated working here. With those barbecues, it's great to get out away from the unit for a few and interact with other people outside there. And I know that the doctors in the emergency room threw a holiday party for us, which was a great opportunity to see everyone in a less stressful atmosphere.
I absolutely feel appreciated. We had, just a couple of weeks ago, we had the security dinner, which, you know, everybody brought in food and stuff, and it was really, you know, it was really nice.
What brought me to Milford Regional was my family. My mother's worked here since 2000. My sister's worked here for 4 years now. Through their discussion on how it is here, I was curious, and when the position opened up, I thought, might as well give it a shot, and I'm glad I did. What's kept me from moving on is flexibility in scheduling. We're running 24 hours a day, so there's a lot of different schedules that come out and I can take on to fit my lifestyle.
I've stayed because I like working in the hospital, and it's a smaller hospital, so you get to know the other staff, like, you know, on a more personal level. The other patient safety assistants, I think together we form a really good team, pretty strong, and everybody's kind of there and has each other's back. So, and they've also been really accommodating with my school schedule, which is nice. In terms of what makes it special to me, why I chose to work here, was the fact that, you know, it's a fantastic hospital, but it's also, you know, not huge, so you get to know everybody, and I just feel like there's like a good positive relationship with all the coworkers here that I have.
I would definitely recommend to my friends to work at Milford Regional. I actually have in the past from the old hospital that I used to work for, and one of them did come aboard.